It's estimated the number of people with dementia will double within one generation in Manitoba and is expected to have a huge impact on our economy. Eating well, exercise, and managing hypertension can help mitigate and slow down the symptoms of dementia. The Alzheimer Society of Manitoba is offering many programs and services to help families and patients diminish their risk or navigate their symptoms of dementia. Joining us now is Nicole McDonald, the Senior Manager of the Dementia Friendly Communities Program. Good morning, Nicole.
Good morning. Thank you for having
Well,
me.
thanks for joining us. Now, tell us a little bit about some of the programs and services that you help tackle.
So specifically for me, I focus on the Minds in Motion program as well as what we call community partner programs. So this is organizations out in the community that have gone through what we call dementia friendly training. So we go through a little bit more of accessibility standards, what we can do for programming and changes to our spaces cost free, but it makes it available for people living with dementia and their care partners to attend and do some hobby-based recreation. So some of those partnerships are Fort White, Manitoba Museum, the Leaf, the Zoo, and then in-house we have our recreational Minds in Motion program.
That's wonderful. Okay, well, let's talk about some of the numbers we're expected to see in this province. We know the rates are high. The baby boomers are getting to that age where Alzheimer's or dementia can set in. Tell us a little bit about what we're expecting in this province.
Yeah, so I mean, right now we have just over 20,000 people living in Manitoba with a dementia diagnosis. By the year 2050, we're expected to see that number double. But what's really important to note is that of those numbers, 61% of people living with dementia reside in community. So they're still accessing these programs, these services. They're going to the grocery store, they're mailing at the post office. So it's really important that we have supports within the community so people can stay at home and age in place for as long as it's safe to do so.
Okay, so let's talk about what we can do before we get that diagnosis.
Yeah, there's lots of things. So when we're talking about, modifiable risk factors, there's 12 of them when we're considering dementia. And these are things that we can implement in our daily life that might slow the progression of the disease or reduce our risk. So it's really focusing on that brain health side of things. A lot of them have to do with physical health. So moving our body, being socially active, managing healthy levels of hypertension and diabetes. We often say things that are good for our heart are good for our brain. So we want to eat well, we want to move our bodies, we want to stay in the community and be social, and those are all really important factors when considering brain health.
And clean eating is very much a big part of that as well.
Absolutely. So focusing on those healthy fats, those whole foods, whole grains, getting enough protein in our diets, and trying as best as we can to reduce the amount of processed sugars and foods that we're consuming.
Okay, so let's flip the coin now. You've just been recently diagnosed. You can slow down the progression of the disease, right?
Yep, absolutely. There's things that we can do, again, considering those modifiable risk factors. There's things that we can implement in our daily life to ideally slow that progression, and that looks like overall healthy living. So if I'm living with a dementia diagnosis recently, I would reach out to the Alzheimer Society and talk to my doctor about some of the programs that you can get into that allow you to be socially active. Aside from our education programs that will also teach you, how to navigate your way through that journey and what to expect in a dementia diagnosis, there's things we can do in our home and in community to better our quality of life and slow that progression.
We've been seeing foods in different categories of color. Color is huge when it comes to a healthy diet, so keep that in mind. The brighter your food, the better for you. Thanks, Nicole, for sharing this with us.
Thank you.